Hello, everyone, and welcome to today's webinar, Being Newly Diagnosed with Enteropathic Arthritis, hosted by the Canadian Spondyloarthritis Association. My name is Brenda Delodder, and I am joined by Dr. Sherry Rohekar, a leading rheumatologist based in London, Ontario, specializing in spondyloarthritis and enteropathic arthritis. Now, spondyloarthritis, as we know, is a complex and often debilitating condition that can significantly impact the lives of those affected. It is the most prominent form of inflammatory arthritis, with more people living with the disease in comparison to rheumatoid arthritis, which surprises many. So today, more than 500,000 Canadians live with this incurable disease, which takes on several forms, including axial spondyloarthritis, psoriatic arthritis, uveitis, enteropathic arthritis, among others. And if you're joining us today, you are someone, or maybe someone you know has recently received a diagnosis of enteropathic arthritis. It's a condition linked to inflammatory bowel disease. So adjusting to this diagnosis can feel overwhelming, but understanding your condition is the first step toward managing it effectively. Dr. Rohekar, thank you so much for joining us to share your expertise and insights today.
Thank you for having me.
Yeah, such a pleasure. Yeah, such a pleasure to have you. So let's start with, could you explain what enteropathic arthritis is and its connection to inflammatory bowel disease like Crohn's and colitis?
So enteropathic arthritis really means an arthritis that's related to inflammation in the GI system, so in your gut. When you think about both Crohn's disease and ulcerative colitis, you're thinking of conditions in which your immune system is creating an autoimmune attack against the lining of the gut, either the colon or the small intestine. And when you're thinking of enteropathic arthritis, it's basically a translation of the same sort of autoimmune attack, but now happening in the joints. So just like you can get inflammation in the lining of the bowels, you can get an autoimmune attack in the lining of the joints. Now, this can happen in several places in enteropathic arthritis, in the lining of the joints, the small joints of the peripheral joints, so the hands, the feet, the knees. And it can also happen in the joints in the back, like the sacroiliac joints, and in the spine.
This is complex. This is such a complex condition. And, when we look at those who are newly diagnosed, people want to know what symptoms to watch for. What are some common early symptoms of enteropathic arthritis?
So common early symptoms include stiffness in the joints, pain in the joints, and then one of the key features would be swelling in the joints. So often patients will start developing pain and stiffness, will sometimes have a preference for the lower extremities, so for the ankles and the knees. But as I said before, it can sometimes affect the small joints of the hands and feet as well. In people who have more spinal involvement, so people who have more of an axial or kind of an ankylosing spondylitis type feature, they may have pain in their low back or in the buttocks, so kind of in the bum region. And again, they'll have some morning stiffness, they'll have pain. They may be waking up in the middle of the night with pain and need to move around and feel stiff.
And when it comes to expectations, we're really talking about that being newly diagnosed, and navigating the healthcare system can really be daunting. And what should newly diagnosed patients expect from their healthcare team?
Well, they should expect that their healthcare team works together. So we really should be emphasizing that it is a team approach. It's really critical that their gastroenterologist gets on board with, first of all, referring to a rheumatologist, and then working together with the rheumatologist to get a treatment that works hopefully for both conditions, their GI condition and their rheumatologic condition. A lot of patients with joint symptoms don't really think of bringing it up at their GI appointments because they don't make the connection to the fact that joint pain can be associated with their diarrhea or their bloody stool. So it's important to advocate for yourself when you see your gastroenterologist. And if your joints aren't doing well, or if you're developing new back pain or worsening back pain, even if your bowels are doing well, make sure you do state that to your gastroenterologist. Even if the bowels are doing well, just make sure that you mention that the joints aren't doing so well. Maybe something does need to be adjusted in terms of medication.
Yeah, definitely. And so medication, let's talk about treatment here for a moment. So treatment is often a concern for newly diagnosed patients. So what options are available for managing ENA?
It depends on the type of arthritis that has developed, whether it's mostly peripheral or mostly spinal. If there's only one or two joints involved, sometimes we as rheumatologists, we love injecting joints, so we can sometimes do a local corticosteroid injection. Many of the medications that are used for the treatment of inflammatory bowel disease, such as Crohn's and ulcerative colitis, actually work very well for the treatment of the inflammatory arthritis that can develop in ENA as well. So sometimes if an arthritis develops, it's enough to push over the treatment for someone who has Crohn's or colitis from maybe a less aggressive treatment to a more advanced treatment like a biologic. And we work together with our GI colleagues to get that treatment started.
And so let's shift into flares here for a moment. And I know that you're going to be offering a session on flares specifically that we'll dive into it a little bit more deeply. But for this session here, for the newly diagnosed, flares can be one of the most challenging aspects of living with enteropathic arthritis. So how can patients recognize and manage them?
It's really difficult to deal with flares because they're unexpected and they're often triggered by stressful events. And the last thing that you really need when you're having a stressful event is to have new worsening pain in your joints. So when a flare occurs, patients should be looking out for worsening pain, swelling, and stiffness. They can sometimes develop a new, very swollen joint, like a new swollen ankle or a new swollen knee. And management of that is to really work with your healthcare team. Sometimes it can be some local treatments. Again, if you have a rheumatologist and you can see the rheumatologist quickly, get in touch with them. A local corticosteroid injection into that swollen joint can do wonders for treatment. Sometimes if there's a temporary flare, it can be something like a short course of corticosteroids systemically, either with an intramuscular injection or a course of oral prednisone. Otherwise, there might be a need for changing systemic treatment if the flares are happening on a more frequent basis.
Yeah, interesting. And so now let's shift for a moment onto lifestyle changes. So we know that the medications and the prescribed treatments are, as you said, they're integral. But so are lifestyle changes. And so beyond the medication, are there lifestyle changes that newly diagnosed individuals can adopt to improve their condition or to manage it?
Absolutely. And one of the biggest lifestyle changes that a patient can make is stopping smoking. So there's really good evidence now that stopping smoking improves outcomes in spondyloarthritis, both in terms of symptom control, in terms of patient-reported outcomes, such as pain, stiffness, and symptoms of their arthritis, but also can prevent damage in the joints and in the back. So if you are a smoker, if you can try to cut back on your smoking, and certainly if you can stop smoking, not only does that improve your symptoms, but it can also prevent progression of the disease. Also, just having a good, healthy, balanced diet, perhaps more of a Mediterranean diet, high in omega-3 fatty acids, can be useful for controlling inflammation.
Yeah, there's been a lot of dialogue that we've been seeing on diet in particular and how that can impact disease management for sure. And perhaps that's a future session that we should touch on. Yeah. I'm just going to go into our final pieces here. And I want to touch on advocacy and self-advocacy and self-empowerment. And advocating for oneself is often critical in managing chronic conditions. What advice do you have for patients to effectively communicate with their healthcare providers?
Speak up for yourself and don't be afraid to do so. You are the patient. You're the one who has this condition, and you're the one who is dealing with all of the consequences of having enteropathic arthritis, having Crohn's disease, and having ulcerative colitis. So remember, you're not just a bag of joints. You're not just a bag of bowel that's sitting there in the doctor's office. You are a whole person, and it's tough when you go see your physician. They're often pressed for time. They're often behind. They're often rushing. They're trying to get through and get to the next case. We're all underserviced and all in a hurry. But make sure that if you are having symptoms that are not being addressed, that those things are heard. Tell your doctor, even when they have their hand on the doorknob there as they're leaving the office door, that there's something else that I need you to know. Even though my bowels are doing okay, I'm having back pain, and I think that I might be starting to have symptoms of enteropathic arthritis that are getting worse, and I need something to be done about that.
I really appreciate your comments here. And I just wanted to touch on that we often hear that when individuals go and see the rheumatologist, that they might be having a good day or a good week or a good month, and that they often underrepresent their entire situation that they've experienced in between appointments. Can you just talk about that for just a moment, the importance of really looking at the time span in between appointments?
It's crucial, and it's also crucial to not be overly stoic. I think a lot of people don't want to be seen as a complainer in the physician's office. So sometimes, I'll see a patient and they'll say everything's fine, and then you sort of see the spouse sitting on the other side going, shaking their head, and they're sort of ratting out the patient by saying that everything's not great. So you're allowed to complain. That's why you're here. We want to hear you, and we want to listen to what's actually going on. Also, in patients with chronic pain, there is a tendency to get used to that chronic pain level and have it just be in the background. Patients tend to be very good at compartmentalizing and becoming used to their new normal level of pain and stiffness. And they have no choice. They just keep going because they have to go to work. They have to take care of their kids. They have to keep doing life. So it's important to think, am I really doing okay? Or is this just what I've become used to? Is this just my new adaptation to my baseline level of fatigue and pain? And maybe should I really try a change and see, will I be feeling better after that?
I'm so glad that you raised that. And one of the newest resources that the CSA has developed is a pain management journal, so individuals can track. It's a booklet that's free for download on our website, and you can really track and provide great accuracy for what you're truly experiencing. So I just want to say thank you so much, Dr. Rohekar, for sharing your insights today. we know that navigating a new diagnosis can feel overwhelming. But your guidance here today has really provided some clarity, great clarity. And to everyone who's joined us here today, thank you for taking the time to learn more about managing this condition. We hope that today's discussion has really empowered you. And we talk a lot about self-empowerment and advocacy, self-advocacy, so that you can take an active role in your care and in your journey. And so for more information or additional resources, please visit our website here. And once again, thank you, Dr. Rohekar, for attending.
And thank you for having me. It's been a great pleasure.
Thank you.